Hello, everyone, and welcome back. As always, I'm your girl, Candy Washington. And before we dive into today's episode, which is Real Housewives of Dallas alum Tiffany Moon setting the record straight as the queen and actual doctor that she is, with Real Housewives of Beverly Hills newbie Annemarie Wiley's wrong, incorrect, and false medical assessment and diagnosis of our girl Sutton Stracke's esophagus disorder. So we have the video clip of what Tiffany Moon had to say. She is calling out Annemarie for lying and being wrong. And then we'll also talk about why we think Annemarie is coming in so hot, particularly against Sutton this season. So before we dive in, go ahead and like, subscribe, and share. So this is from All About the Real Housewives, All About the Truth. It says, former Real Housewives of Dallas star Tiffany Moon slams Real Housewives of Beverly Hills newbie Annemarie Wiley's disturbing comments about Sutton Stracke's esophagus disorder. On the most recent episode of The Real Housewives of Beverly Hills, newbie Annemarie Wiley, a nurse anesthetist, went after Sutton Stracke's esophagus disorder. Annemarie made it seem that Sutton was over-dramatizing the seriousness of her throat issues. Narrow esophagus, that's a symptom of something. That's not a medical diagnosis. If you have like a stricture in your esophagus, all you do is chew your food more. If you really have a problem, you go get treatment for that. The Real Housewives of Beverly Hills newbie told Sutton. Sutton retorted, "Shall we go get my esophagus stretched all together as a group?" Days after the Real Housewives of Beverly Hills episode aired, the Real Housewives of Dallas alum, Dr. Tiffany Moon, an anesthesiologist, blasted Annemarie for weaponizing her medical profession to tell Sutton things about her own condition. And I agree 100% with what Dr. Tiffany Moon is saying. Number one, I think it's very dangerous anytime someone who is a medical professional or not tries to interject in somebody else's medical condition, diagnoses, and treatment. I also thought it was very inflammatory and dangerous for Annemarie to say that no doctor would say that Sutton could drink on the medicine that she's on. No, like, licensed doctor or whatever she said, trying to make it like her doctor either was doing something like medical malpractice or he was lying or she was lying. That's also very, very dangerous and could put Sutton's doctor in a sticky situation, even though what he told Sutton was correct and what Annemarie was saying was incorrect. So there's a lot going on. On TikTok, Dr. Tiffany Moon said, "The whole scene was kind of cringy to me. I don't know what made her go at Sutton so hard, especially when it was her party. Like, I found that to be incredibly rude. But yeah, let's not weaponize your medical knowledge to come at people, especially when you're wrong." Now, the reason why we think that Sutton was Annemarie's target is a couple of things. One, because Kyle and Sutton are so at odds this season. They definitely are beefing. They're not getting along. That is very clear. And I think that Annemarie took it upon herself to be Kyle Richards' mouthpiece and go after Sutton as a way to show her loyalty and alliance to Kyle. We know that Kyle has a history of having sort of puppets for her and mouthpieces for her, whether it's Dorit or whether it's Teddy Mellencamp. She needs someone on her side who is basically going to be her yes person. Or maybe in this season, it seems to be Annemarie and also Erica Jane are very much yes people to Kyle this season. Kyle admitted that she kind of ended her friendship with Dorit when Dorit spoke out against her at the last year's reunion. And it wasn't even against her. All she said was, Kathy just wants you to take a little bit of accountability for the situation you're in. And ever since Dorit said that, Kyle has been icing her out. So unless you are Kyle's yes person and you fight her battles on her behalf, she's going to villainize you and make herself the victim. But as long as you are being her mouthpiece and you are defending her and fighting her battles, then, you'll be in her good graces and you think that you have a better chance on staying on the show. And we saw this. Kyle was talking to Annemarie about Sutton's esophagus issues, and Annemarie literally said, "Well, I'm going to have to ask her about this. I'm going to have to question her about this." Why? You don't know Sutton. You're not her doctor. You're not even a doctor. So who do you think you are to question her on her own medical condition? And just like Dr. Tiffany Moon said, especially when you're wrong. She then explained the details of Sutton's condition and how it can be treated. She says, I'm going to digress a little bit here and just talk about the esophagus. So, I'm not going to read all what she said because I have the clip and we can just listen to Tiffany Moon herself because she's an actual doctor and she's going to 100% tell it like it is. So, let's watch the video and then we can discuss. Okay, here we go.
Narrow esophagus, that's a symptom of something. That's not a medical diagnosis. If you have like a stricture in your esophagus, all you do is chew your food more. If you really have a problem, you go get treatment for that.
Shall we go get my esophagus stretched all together as a group?
Okay, so a bunch of you guys tagged me in this clip of Annemarie talking to Sutton about her esophagus, and I finally had time to watch the episode, so now I'm gonna weigh in. I think it was very disturbing how Annemarie was like weaponizing her medical profession to tell Sutton things about her own condition. I'm gonna digress a little bit here and just talk about the esophagus. So the esophagus exists for one reason, which is to get food from your mouth into your stomach. It's just like a long, narrow tube. Sometimes the esophagus can have a stricture, which is a narrowing, and it can be severe or it can be mild. The first symptom that patients usually present with is difficulty swallowing. So you don't just chew your food more. Like a stricture is a stricture, and you can chew your food all you want, but unless you blend it into a smoothie, if your stricture is narrow, you're gonna have like the feeling of some food stuck in your esophagus. The most common cause is GERD, which is reflux disease, very common, peptic ulcer disease, cancer, eosinophilic esophagitis. Now, I specialize in thoracic anesthesia, so I'm very, very familiar with the procedures that we use to dilate the narrowing. It's basically we put a scope down the patient's mouth and go into the esophagus and locate where the stricture is. And then using a bougie, a balloon, or a guided wire, we are able to tent open the stricture a little bit more. I have done hundreds of these surgeries, and it's a minor procedure. You do have to undergo general anesthesia for it most of the time. The whole scene was kind of cringy to me. I don't know what made her go at Sutton so hard, especially when it was her party. Like, I found that to be incredibly rude. But yeah, let's not weaponize our medical knowledge to come at people, especially when you're wrong.
Yes. So Dr. Tiffany Moon is an absolute queen, and she explained it perfectly. And also, don't forget that I mentioned it a little bit before, but since Dr. Tiffany Moon only talked about the esophagus, but the medicine that Sutton Stracke is on, I believe it's for her feet or circulation or something like that. Again, I'm not a doctor. I don't diagnose. Take notes, Annemarie. The drug that Sutton's on for her feet, she said that she's allowed to drink on it. And Annemarie was like, no, you're not. That was also a lie because we Googled it and we looked it up. And the first thing it said was, you are allowed to drink on this medication. Like, you're allowed to drink on certain medications. Obviously, some you're not. But again, that was another lie. So I don't know if Annemarie was purposely lying or if she's just this incompetent. But either way, it's very cringy and it's very dangerous to weaponize your alleged medical knowledge and also to say these things so definitively when you don't know what the hell you're talking about. Because that doesn't just put Sutton in jeopardy, it puts the people watching this in jeopardy who may actually believe you. And it also puts the doctors who are prescribing Sutton and talking to Sutton in jeopardy, even though they've done nothing wrong. But you making these accusations that they're doing some type of medical malpractice is very alarming. And you should be concerned, I'm looking at you, Annemarie Wiley, about your reputation within the medical field, because who's going to want to work with you? Who's going to want to hire you when you're out here saying very dangerous things about other reputable doctors and then also misdiagnosing when you're not someone's doctor or physician, and then also saying medical terms and conditions and diagnoses incorrectly. So the person that needs to be worried is you. But I want to know what you guys think. Do you think, do you agree that you think Annemarie is coming so hard for Sutton because she wants to prove her allegiance to Kyle? Or do you think she's just coming for Sutton just because she wants attention, she wants a moment, whatever the case is? And are you like me and you think it's very dangerous for her to say so definitively these medical, conditions and diagnoses and all this stuff when she's 100% wrong? So put it down below and let me know what you guys think about Tiffany Moon, what you think about our girl Sutton Stracke, Kyle, and the newbie Annemarie. Should this be a one and done? That's what I think. I think we already have had enough of her. But put your thoughts down below. And before you do that, be sure to subscribe, like, and share. And I'll talk to you next time. Bye.